The Sexuality of People Living with HIV in North America, presented by Eduardo Levi. Before we begin, we should define some terms that are going to be used throughout this presentation. HIV, human immunodeficiency virus; AIDS, acquired immune deficiency syndrome; PLWH, people living with HIV; WLWH, women living with HIV; viral load, a measurement of virus particles per milliliter in a person's bloodstream; MSM, men who have sex with men; biological, psychological, and sociological, which are labels that are going to be used at the top of each slide to denote which perspective is being used. HIV is a retrovirus that can be spread via mucous membrane contact or damaged tissue contact with infected blood, semen, vaginal fluid, rectal fluid, and or breast milk. It is most common for people in the US to transmit HIV through risky sexual behaviors such as unprotected vaginal or unprotected anal sex and or unsafe needle or syringe use. HIV targets CD4 receptors on helper T cells, a type of white blood cell that helps the immune system combat cell abnormalities and infections. If left untreated, HIV advances in 3 stages, gradually reducing the immune system ability to fight off infections. The first stage is known as acute retroviral syndrome and develops 2 to 4 weeks after initial exposure. Some people experience flu-like symptoms, while others experience no symptoms. The disease remains asymptomatic for up to 10 years during the second stage, called chronic infection. However, during this time, the virus continues to replicate at low levels and damages the immune system. The final stage of HIV infection is known as AIDS and is marked by the onset of opportunistic infections, cancers, and dangerously low CD4 levels. Without treatment, AIDS results in death within a matter of months to years. HIV/AIDS currently has no cure, but consistent adherence to antiviral medications can suppress viral replication and prolong life. The CDC has considered HIV an epidemic since 1981. While the number of new infections has drastically decreased since the peak of the epidemic in the 1980s, thousands of people are diagnosed with HIV each year. In 2018, the CDC reported that there were an estimated 1.2 million people in the United States living with HIV. One of the reasons for the decline in new HIV infections and the increase in life expectancy of people living with HIV is the result of HIV prevention and treatment medications. ART is a general term used to describe a drug or a combination of drugs that, if taken consistently, can drastically slow the progression of HIV by reducing a person's viral load. When the viral load is reduced, this also reduces the virus's ability to infect new CD4 cells. Thus, a person's CD4 count may increase and fend off cancers and infections, similar to the way the immune system of a person without HIV would do. In addition to reducing viral load, ART can also reduce the transmission of HIV through sexual contact while also lengthening an HIV-positive person's life expectancy. ART drugs can act through biochemical mechanisms of preventing viral genome integration into host cell DNA or preventing new viral particles from maturing or assembling. After a while of being on ART, a person's viral load may eventually reduce to a level where it can no longer be detected by standard blood tests. When this happens, the person is said to be undetectable. When a person is undetectable and consistently taking their ART medication, the chances of transmitting HIV to a sexual partner are very low. However, HIV could still be found in its respective body fluids, and the person living with HIV should continue to take steps to prevent transmission to partners. For this reason, serodiscordant couples should adhere to safe sex practices. A couple is said to be serodiscordant when one person is infected with HIV and the other is not. One option for serodiscordant couples is pre-exposure prophylaxis, or PrEP. PrEP prevents the transmission of HIV to people who do not have HIV and are at high risk for contracting the virus. By taking 1 pill a day, PrEP reduces the risk of transmission by 90%. It is important to use PrEP consistently and correctly because when it is not taken as instructed, the medication is not effective in preventing HIV. The risk of getting HIV from sexual contact with a person living with HIV can be reduced even more if PrEP is combined with correct and consistent use of male latex polyurethane or polyisoprene condoms and or female condoms. A couple is said to be seroconcordant when both partners are HIV positive. In addition to each person adhering to their own ART, a seroconcordant couple should also use safe sex practices because each partner could have different strains of HIV and reinfect the other. This is known as HIV superinfection, and it becomes a lot harder to treat HIV. These advances in HIV treatment have made it possible for women living with HIV to give birth without transmitting the virus to her child during pregnancy, labor, delivery, or childbirth. As a result, in the US, the number of mother-to-child transmissions per year has decreased by more than 90% since the 1990s. However, much of the world still struggles with this kind of transmission. It is important for the infant to take HIV medications for 4 to 6 weeks after delivery. If these steps are taken, then the risk of mother-to-child transmission is less than 1%. It is also important for the woman to avoid breastfeeding, as this can transmit HIV to the child. However, several studies have found that women living with HIV face numerous psychological challenges in their sexual and reproductive health. Women living with HIV may feel stressed and isolated because their culture expects them to not be sexually active because they are HIV positive. Another important finding is that despite being on ART regimens, many women experience hopelessness about pregnancy because they have a fear of transmitting their HIV to a sexual partner or a child they might give birth to. It is recommended for healthcare providers to consider a holistic approach towards women living with HIV and their pregnancy, rather than solely focusing on the HIV infection, because this makes the woman feel more human. An HIV diagnosis can have a significant negative impact on a person's sexual interest, sense of attractiveness, and appeal to a sexual partner. A study found that many HIV-infected women felt that after their diagnosis, sex was not enjoyable because they were plagued with anxiety, worry, and fear. This loss of their perception of themselves as desirable caused many women to fall into depression. Thus, many of the women expressed that they would have rather preferred an emotional connection with a partner instead of a sexual relationship. HIV-positive people are also more likely to exhibit symptoms like depression, fear, anger, and guilt than the general population. Although people living with HIV showed significantly more instances of suicidal ideation, suicide attempts were not more prevalent than in the general population. Moreover, mental health problems in HIV-infected patients have a negative influence on the treatment, adherence to treatment, and prognosis of HIV infection. Poor adherence to treatment combined with psychopathologies like depression and substance abuse can increase risky sexual behaviors and thus increase the chances of spreading HIV. In a 2013 study by Sade, people living with HIV displayed a considerably higher level of drug use than HIV-negative people. Furthermore, ART may have adverse interactions with substances, or the substances being used may impair judgment. Not taking HIV treatment as prescribed can then worsen the overall consequences of HIV while increasing the likelihood of spreading HIV to sex and drug-sharing partners. It is worth mentioning that reforms have been made to integrate mental health and substance abuse counseling into HIV treatment. Many healthcare providers are working with patients to develop treatment plans that integrate HIV education, effective condition management, and healthy decision-making that maximizes quality of life. Some examples of substance abuse complications include excessive alcohol consumption, which is linked to risky sexual and drug behaviors, and smoking tobacco, which puts people living with HIV at risk for developing pneumonia. Unfortunately, injection drug use is viewed as a criminal activity instead of a medical issue that can be treated with rehabilitation and counseling. Skepticism about the healthcare system may prevent people living with HIV who inject drugs from seeking treatment. Furthermore, homophobia may place men who have sex with men at risk for physical and mental health problems. This can come in the context of a person's own ethnic or racial community or structural stigmatization. For example, Black men who have sex with men often find that the Black community tends to be less open about sexual orientation, which could cause a gay, bisexual, or queer man to not seek treatment for HIV for fear of being outed. In the context of structural stigmatization, factors such as public policy in southern US states often lack or underinvest in social services that would benefit population health and improve prevention and treatment of HIV. People living with HIV in many southern communities find themselves at odds with prejudice, lack of access to treatment, and conditions that perpetuate HIV transmission. Although ART has made living with HIV comparable to living with a chronic condition, HIV has not yet reached the normalcy of other chronic conditions. In addition to stigma and prejudice, the criminalization of HIV non-disclosure has impeded HIV from reaching a normal disease status in our society. HIV disclosure has many benefits, such as access to treatment and support, but there's often a trade-off in the sexual behaviors of individuals. A 2018 study found that HIV non-disclosure criminalization laws inherently put women living with HIV at an increased risk for interpersonal violence. Furthermore, people living with HIV must contemplate the decisions of HIV disclosure to potential partners. Factors that many women consider are related to fears of having their HIV status publicly exposed, loss of child custody, and challenges associated with reporting sexual violence to law enforcement. In the same study, the negative impact of the criminalization of HIV non-disclosure on sexuality has caused many women to fear intimacy. STIs and getting tested for STIs are considered taboo and carry their own stigma, but disclosing HIV status to a new partner is scary and stressful for people living with HIV who are also learning to embrace their positive status.